I have the great pleasure of hosting Dr. Jonathan Reisman. So, Dr. Reisman, thanks so much for your time and for doing this podcast.
Pleasure to be here. Thank you.
Wonderful. So, I'd like to start our discussion with the first question. How has your work in global health shaped your views on what it means to be healthy?
What it means to be healthy. That's a good question. I think seeing health or disease really, or practicing medicine in different contexts really helps you understand both health and disease. I think in different cultural contexts or different geographic contexts, different climates. Obviously, the most obvious thing is you see different diseases in different countries. Some of them infectious based on climate to some extent. Other times related to food or lifestyle. So I think it's very useful for doctors to see health and disease in many different contexts like this. And I think you can also see the impacts of modern life and technology when you see communities who don't have that technology. Obviously, you can get a very good perspective on health and disease. I think it helps you be a doctor in those contexts, but also if you come back home to your normal, boring, climactic and socioeconomic context of practicing medicine, it can also be helpful there, especially in the U.S. where we see people from all over the world. Sometimes having just arrived in the U.S., I see quite a number of people from around the world. So that can certainly help also give you more perspective on both health and disease.
And what would you say are the most common misconceptions people have about their own health?
I think in general, it seems to me people are very bad at causality, figuring out which thing is the cause of which other thing. So a lot of times that happens when people come into the ER and I'm trying to help them and they tell me what's been going on the last few days. They'll often blame their symptoms on certain things that I think are totally irrelevant, or fixate on one thing maybe that impacted this other thing that is probably totally unrelated. And not that it's anyone's fault. I think before I went to med school, there was a lot about the human body's working and the causality of what causes one thing to happen or a symptom to arise. It can be very confusing, and people in general, I think when most people look at the world, whether they're looking at economics or politics, or weather or their own body, we're just sort of bad at causality. We're good at making associations, but we're really bad at pointing to what exactly caused it. And, people will fixate on the one thing that happened 20 years ago as definitely the one and only cause of what they're experiencing now, and they're often wrong about that.
Right. And what would you say is the role of lifestyle choices in maintaining long term health?
Certainly, lifestyle is important. I do think that, for instance, when it comes to, let's say, exercise and nutrition, I think the evidence in general isn't great, and doctors think they know a lot more than they do about how these things impact health. And I think there's a lot of misconceptions, and even the medical mainstream medicine has been very wrong on many nutritional questions going back many decades, whether it's our promotion of trans fats, or other foods or low fat diets. I think it misses a lot of variability from one person to the next, what might be the ideal diet for them. There's a ton of extrapolation, for instance, from a old sick adults to children who are healthy in nutrition, that I think makes no sense. So I have to believe that eating a healthy, varied diet and getting exercise is good for you, but I'm not really willing to say much more than that or get into any more detail than that. So I'm not sure a mainstream doctor like me is even the best person to ask for nutrition or health style or lifestyle advice.
I see. And what parts of human body fascinate you the most, and why?
To some extent, all of them, which is why I did not subspecialize and why I remain a generalist, because I do love all the different body parts. But certainly, the heart and the brain are two fascinating ones, and I think the general public, perhaps with no medical education, might also seize those two as the most interesting. They're sort of interesting in very different ways because the brain is super complicated and there's a lot we don't know about it. As where the heart seems in many ways to be the simplest organ. It's basically a mechanical pump that fills with blood and then pushes it. That's kind of it. So even though it seems like this very simple mechanical, mathematical, pump, um, it really is complicated, and you can study it for decades and never run out of new things to learn about it or new ways of seeing how its function impacts the health of the body. So and both are, I think, diagnosing heart attacks with an EKG and diagnosing strokes by doing a neuro exam on patients are two really interesting ways that I interact with those organs very frequently. And just from looking at an EKG, you can almost tell which artery in the heart, which coronary artery or branch of an artery is the one with a blood clot in it causing this person chest pain. Or with a stroke, by going through a neuro exam, you can actually tell where the blood clot might be in the cerebral arteries. And so there's a deduction, you're like a detective using your knowledge of that organ, how it functions and how it's organized regionally, and then interacting with a patient, a new patient. No two strokes or two heart attacks are ever exactly the same. So it's always like a little bit unique. And you're sort of peering into this person's body using this technology or this exam to sort of know where the problem lies. And I find that act very endlessly fascinating.
Would you say that high blood pressure is maybe number one silent killer nowadays?
Yes. I don't know if it's number one, but it's definitely a big one. Smoking cigarettes is still common, maybe less common than it used to be, but still a big factor in hardening the arteries and causing whether it's coronary artery disease or cerebrovascular disease, which can lead to strokes. Definitely smoking, heart attacks, um, diabetes is a huge one. So just the having high blood sugar and having high insulin levels for type 2 or having low insulin levels for type 1, either way, it definitely has a huge impact on the arteries, not only to the brain and the heart, but also the legs, and which causes problems for the feet. People often get, a lot of trouble with their feet when they have diabetes and peripheral vascular disease. So, but yes, high blood pressure does seem to be an important factor there.
Mhm. And can you maybe share some surprising or unknown facts about human health that people might not know?
Sure. Let's see. Surprising facts about human health. Well, going into the cold weather with wet hair does not cause pneumonia. That's a that's an interesting one. Although I did see a study recently that maybe in the cold air, viruses can attach to the lining of the inside of the nose a little better, which almost suggests, oh, maybe cold weather does make you more susceptible to colds at least. But the majority of pneumonia, for instance, the bacteria causing it is already living in your throat and kind of got down into your lungs for whatever reason. Maybe you had a cold that made it easier for it to get down there. But the bacteria, that causes, let's say, skin infections or pneumonia or sinusitis or ear infections, it's already in us or on us, and it just kind of is able to get past our defenses. So it's not really, usually not something you caught from someone else.
Right. And how would you explain the interconnections of different body systems in layman's terms?
So every bodily system is intertwined with every other one. So, I mentioned I'm a generalist because I deal with people who have problems in every body part, from hair to toes and toenails and everything in between and every internal organ. And you're often using one body system to look at the other. So, for instance, body systems are very interconnected. A lot of times in people with liver failure, for instance, we watch the kidneys to see uh, to sort of get an idea of how the liver is doing. So you think you want to know how the liver is doing, you test the liver, but actually, sort of as liver failure progresses and is in its end stage, we watch the kidneys, another organ, to know when the liver is sort of on its last leg or kind of hanging by its last thread, because it's the kidney failure that signals sort of the end. And the same goes actually with heart failure. When people with severe heart failure start getting kidney failure too, that's a sign that then the heart is really kind of in its last throes. And so we often do that. I like to say it as doctors are ecologists of the internal organs because we look at other organs to know the health of separate ones, and we often look at the sort of whole system the whole ecosystem of organs to know that about the health of the person as opposed to just looking at any one given organ.
And what is the one most common thing people don't realize how their bodies function?
A very common one that I hear from my patients is that, let's say patients come in with diarrhea, very common problem, of course, the world over, and they think they stop drinking or eating because they think, if I don't put anything in the top, I will not have diarrhea, nothing will come out the bottom, which of course is not true because most infectious diarrhea, your colon is secreting all this mucus and juices and things to create what ends up coming out into your toilet. It's so, and actually not drinking or not eating, especially not drinking and becoming dehydrated, is the main problem with diarrhea. So even though it feels like, oh, if I put more liquid through the top, more liquid will come out the bottom. No, that's not true. And even if it does, you still need to put liquid in the top so you don't get dehydrated. So you have to match the diarrhea with more liquid intake.
Can you discuss the role of inflammation in chronic diseases?
To be honest, I would, I'm an ER doctor, so I deal mostly with acute things and less with chronic conditions. Though I think that the understanding of modern medicine is very limited on chronic conditions. We're fantastic at treating acute conditions, like the treatment for heart attacks and strokes and surgical emergencies and trauma is unbelievable today. We are so good at it. Chronic diseases, we're okay, we're getting better, pretty good, but there's so much that is still a hole in our understanding. Inflammation, I think, is a little bit controversial. Some years ago, even before I went to med school, there was some blood test, like something called a CRP, that was supposed to tell you all about inflammation and give you risk of the patient's, future having a heart attack, stroke, etc. And people don't really use it anymore because it wasn't as accurate, or it didn't give you as much information, or you couldn't act on that information anyway. So I'm not actually sure where chronic inflammation stands. It certainly seems to play a role in the hardening of the arteries and the growth of plaques inside the walls of the arteries that do end up putting people at risk for heart attack, stroke, peripheral vascular disease, etc. There is a role there, and certainly decreasing inflammation seems like a great idea. If you have chronic tooth inflammation, it's also uncomfortable, not to mention maybe it's making atherosclerosis grow in your arteries. Um, so I'm not really sure. I'm not sure anyone is sure how inflammation ties into chronic disease, to be honest.
I see. And how does the body adapt to extreme environments like the wilderness or high altitudes?
Yeah, so I've been really blessed with so many interesting experiences practicing medicine in wilderness and high altitudes and very remote parts of the country and the world. And the human body is incredibly adaptive. For instance, when you go to high altitude, um, depending how quick you gain altitude or gain elevation each day, sort of plays a big role in how you will feel. So, you know, you adapt on many levels. Actually, the human body has multiple overlapping ways of adapting. So when you go to high altitude, you might feel ill for the first few days, but then your body adapts through acclimatization, so you start feeling better. So you start breathing faster because there's less oxygen in the air, and that breathing faster impacts the pH of your blood, and then your kidneys also compensate by putting more sodium bicarbonate in the urine to sort of buffer the pH changes. That's the sort of understanding of acclimatization in the body. It's sort of the lungs and the kidneys acting together. But like in many areas of medicine, I think the stories that we tell to explain things are very simplified. I'm sure it's more complicated and there's more body parts and organs involved in acclimatization, but that's our current understanding. And it really works. If you go to altitude and then stay in the same elevation for a few days, I mean, you feel dramatically better in 3 to 4 days. But then if you stay there for a few months, there's another adaptation, right? Your body senses the low oxygen, and your kidneys and liver secrete a hormone called erythropoietin, which makes your bone marrow rev up and start making more blood cells, especially red blood cells. So your hemoglobin increases. So because there's less oxygen in every breath, your blood is getting more blood cells to carry the oxygen. So even though you're breathing in less, your blood can carry more oxygen per unit volume. And that takes place over months to years. So people who live at altitude for months and decades, their hemoglobin gets very high. And that's a reason that athletes like to practice at altitude, because it makes their hemoglobin higher and they can compete at bike racing, running, etc., because their blood can carry more oxygen, or they can actually dope with EPO or erythropoietin, inject it into themselves at low altitude, which actually simulates what your body does at high altitude. But anyway, there's one more layer of adaptation, which is over generations, of course. So genetic evolution, people adapt to different environments, whether that's let's say, the Inupiat or the Inuit who live in the Arctic, and obviously their bodies have changed to be most adapted to that harsh environment with low levels of light much of the year, obviously very cold temperatures, and a very particular diet. The same goes for people who have lived at altitude for years, like the people who live on the border of Tibet and Nepal, who trade over the mountain passes historically for centuries, and their body has adapted ways of dealing with the climate. Now of the elevation. Now, to their surprise, actually, I saw a lot of them. They would go down to a city like Kathmandu, which is at low altitude, and then just come right back to their home, which is at high altitude, and think that because they lived there their whole life, they are protected. But actually, you lose acclimatization quite quickly, like in 1 or 2 weeks at low altitude. So they would come back to their home where I was working and be sick and be shocked that someone like them, who is of a Nepali ethnicity and who has lived at altitude their whole life and their families live there for generations, they can still get acclimatization. They still have the genetic adaptation and they still have the high hemoglobin, but you lose the acclimatization of the lungs and kidneys in just a week or two. So those three layers of kind of evolution or adaptation show you how smart the human body is, really, without us even thinking about it. It's really smart at responding to external stresses and compensating for it.
Hmm. And how does the gut microbiome influence physical and mental health?
Good question. Very controversial topic. Many people are asking that question these days. It certainly seems to impact gut health, right? Well, that's where the bacteria are living, in the gut. Certainly seems to impact, cause certain infections, cause certain problems when it's out of balance, and contribute to health when it is in balance. Just like, for instance, there's a microbiome in the vagina, and when it gets out of whack too, there's a variety of conditions that can cause bacterial vaginosis, is a common one, where it doesn't seem to be caused by one bacteria that comes and causes infection, but rather a sort of imbalance of the entire microbiological ecosystem. The same happens in the gut, and probably the same happens in our throats, in our noses, on our skin. Um, so a lot of times where there's a new concept in medicine, people find out or see evidence that it is related to everything. And maybe it's the secret key to all these diseases we've struggled to manage and treat for decades and centuries. Perhaps the microbiome is the answer to so many different problems. And maybe it is, but usually it ends up being not that one key that solves everything, but perhaps just the key to a few particular diseases. So when fish oil came around, we thought it was the cure for everything. And then we thought vitamin D was the cure for everything. And now we think maybe fecal microbiota transplants or stool transplants are the cure for everything. Maybe it's the cure for some things, probably not everything. I don't think there's any panacea like that can really treat everything. But it's exciting to be, I've witnessed a few of the initial phase of, let's say, now it's the microbiome. It's sort of, there's all this excitement and saying, oh, maybe it relates to mental health, and maybe it relates to obesity, and maybe it relates to everything. Maybe it does. I would love for that to be the case, but I guess we'll have to wait and see.
What are your thoughts on the increasing popularity of specialized diets such as keto and vegan?
I think it's interesting. I think it makes a lot of doctors nervous, but at the same time, doctors have been giving dietary advice that's basically worthless for many decades. This diet, that diet, the other diet, where none of them really seem to work all that well. And even like medicine's focus on nutrition is relatively new. When I was in medical school, we had a very minimal nutrition course, and it was actually just introduced. So students before me never really even had a nutrition course. And like I said before, a lot of the nutritional dogma in modern medicine is was wrong and likely is still wrong. So I think we have to wait for more evidence. Um, but yeah, so I do think that that's a problem going forward.
Right. And what would you say is the relationship between mental health and physical health?
I do certainly think they're related. I think that for a lot of people who are depressed, I've even seen some studies where dancing or introducing some new exercise regimen is good for people with depression. I certainly think activity leads to some improvement in mental health. I mean, when you're active, your body secretes endorphins, which are endogenous opioids, in the opioid chemical family. Um, Obviously, opioids have downsides as well, but you have to imagine that some vigorous exercise contributes to well-being, maybe because you're just getting an opium high basically from your own brain and spinal cord. I don't think that's the only reason, but that's one physiologic explanation, at least that we have at hand, that maybe explains something, an improved mood with exercise. But I certainly think physical activity sort of quiets the mind a little bit, makes people focus on something other than their own misery or whatever stressors in their life they've been ruminating on over and over in the mind, kind of gets you out of your uh, whatever rut you're stuck into, kind of changes the scenery. Certainly, little changes like that, I think, are very good for you. Not to mention just being physically healthy is great for self confidence and your self perception, and probably just good for things like blood flow to the brain and efficiency of your heart and your ability to enjoy activities. So I think probably in many ways your physical health and physical activity relates to improved mental health.
And how do you help patients manage stress to improve their overall well-being?
Well, it's not so easy. As an ER doctor, I'm often seeing people sort of when their anxiety gets out of hand or is starts interfering with their life, or when their anxiety and depression are so bad that they're thinking about hurting themselves or hurting someone else, and that's when they come to the ER because they think they need to be hospitalized, or maybe they're just actively trying to kill themselves and someone else interferes and calls the police and brings them to the ER. So I'm often, as a ER doctor, seeing people sort of in the extreme moments of their condition. Not their daily anxiety where they think too much about one problem, but where that has led them to have a breakdown or something, or feel unsafe. Um, so it's kind of hard. In a way, often just managing people through that sort of acute issue with their anxiety or their depression or mental health, and I'm not often giving them advice on the long term. But you know, certainly physical activity is part of it. Sometimes like getting new friends, changing up your environment, changing up your milieu, practicing relaxation exercises that you can learn on YouTube or from an app, or various podcasts, are supposed to help with anxiety. And there's even some new AI apps you can use on your phone, almost like therapists, someone that you can talk to. It's actually just a machine, but humans are pretty we're like we are machine like ourselves in a way, so it's not surprising that we can get comfort from talking to another machine.
And can you share some insights of how emotions manifest physically in the body?
Sure, certainly. I see a lot of people with chest pain, for instance, and one very common cause of chest pain is anxiety or panic attacks, let's say. So a lot of times when people with chest pain or even just palpitations, they can feel their heart beating or feel their heart racing. Sometimes it is actually racing, sometimes it's not. um, Certainly that's one dramatic way in which anxiety, let's say, can produce symptoms in the body. Those people are actually feeling chest pain doesn't mean that there's anything actively wrong with their heart or lungs or anything else in the chest. But certainly mental duress or mental problems can manifest with symptoms in the body. And it's sort of like self reinforcing, because anyone with chest pain gets nervous because they wonder, am I having a heart attack? So it sort of feeds on itself. And so symptoms in the body can produce mental or psychiatric reactions, and psychiatric or mental problems can produce symptoms in the body. But in a way, emotions have the two sides, right? There's the side that's up in the head that you're just thinking about, but then there is a kind of body component to depression or anxiety. There is the heart, let's say, beating faster with anxiety, or the blood pressure rising, or changes in the arteries, or secretion of stress hormones like adrenaline and epinephrine and cortisol. There are real physiologic changes in the body that are associated with these emotional disturbances, and so they can sort of feed on each other in a big way.
Right. And what strategies do you recommend for fostering resilience in patients?
Well, I think, certainly, obviously, exercise and diet. A lot of times I'm telling people to cut down on alcohol, cut down on cigarettes, cut down on vaping, whatever might have related to the problem that brought them in. Cut down on meth for sure. Where I work in rural Pennsylvania, I see quite a lot of problems with meth and other drugs. Um, I think a big thing that I try to tell people, especially with psychiatric problems, is that it's very common. Especially I see a lot of teenagers who are going through very stressful times. Let's say a teenage boy broke up with his girlfriend, or his girlfriend dumped him, and he thinks it's the absolute end of the world. There's no reason to live. I might as well kill myself. All my loved ones will be happier if I'm gone. Nobody needs me. And I try to, I guess, again, I'm often helping them through the acute episode and figuring out how we can help them, perhaps with a psychiatric hospitalization. But I often try to say, this is very common. I see people like just like you all the time, with similar problems. What you're going through is not unique. You don't try to say like, oh, you're not. I'm not trying to say like, why are you worrying about this stupid, irrelevant thing? But rather, just like being a teenager is difficult. You're going through a difficult time in your life. All teenagers, to one extent or another, suffer from the same things you're feeling right now. And then when you get older, you won't it won't seem nearly as important. Things like that. Does it help? I'm not sure.
So, how can people better understand and manage their risk factors for common diseases?
Well, definitely, cutting down on all the risk factors for heart disease and cerebrovascular disease, peripheral vascular disease. Stop smoking is great. Eat healthy, lose weight, exercise. Um, I mean, I guess that's one of the common things, and then also obviously get your screenings. When you're due for your colonoscopy and your mammogram and your Pap smear and whatever it is. Obviously, do all those things. It, some of the evidence for a lot of those things, I think, is not very strong. Um, it depends on each individual thing has a very sort of unique evidence base, but certainly, with some fudge factor, all of those things are pretty important and have contributed to a significant decrease in certain kinds of cancer. So keep that up.
And what are the best ways to build a strong immune system, especially now in the winter times?
It's a good question. We modern medicine really doesn't have any medicines to help the immune system. I mean, in let's say in people who are undergoing chemotherapy for cancer, and we're completely destroying their immune systems as a side effect of the chemotherapy by wiping out, let's say, all the white blood cells. We do have ways of restoring that immune system, but in the average healthy person, how do we augment the immune system? Um, we don't really know, to be honest. Maybe the microbiome, everyone's obsessed with vitamin C and other vitamins. Maybe they help a little bit, probably not a huge impact. Um, you know, Washing your hands often, not training yourself not to touch your face in cold season. Like, many colds are transmitted from one person's nose to their hand to the other person's hand to their nose. So not touching your face and washing your hands often probably help. Masks might help too. I don't wear one, but other people might, and that probably does decrease the risk of a cold somewhat, especially if you're very close to other people who are sneezing and coughing in your face. But not sure how well.
I see. And what lessons can people in the developed countries learn from global health practices?
Um, Well, I think at least going to those places and seeing what life is like with less technology or less dependence on complex systems and less daily dependence on sort of all these services that we've come to take for granted can be very enlightening, I think, and change your quality of life and change the way you see things. I feel like there's that psychological component that I think is really useful for seeing things. But also, it's interesting, I think, and enlightening to see how people do live with much simpler ways, almost like going to some countries feels like going back in time a century, perhaps, and seeing what the U.S. was like back then, or how people lived, or how did people manage with 9, 10 kids in the house, or without any modern technology, or how did they do things themselves? How did they everything from weaving baskets to whatever other, making their brooms. I remember I was in India and was watching someone make brooms out of branches on the sidewalk. I never even thought of how it was a broom made. And for me now, and now I see brooms a little differently because I sort of saw how that was done. So even that, you can see sort of what's behind, the objects in your daily life, which for me is sort of one of the best parts of traveling or seeing people who live in a different lifestyle, sort of understanding where all this stuff came from and how life can be lived without it, even if you don't have to live without it, because you're very fortunate, as many of us are in the U.S. It's still useful to see what's kind of behind those objects or what life is like without them.
And what global health challenges concern you the most these days?
Certainly, so I've done some global health in India and in Tanzania as well. Part of my work there was focusing on neonatal and maternal health and mortality. So, for instance, in rural parts of India and Tanzania, the immediate care as children are being born is sometimes suffers from lack of certain equipment. It's not necessarily expensive equipment, but it's just hard to have it in every little health center through in the rural parts of a country where it often needs maintenance or needs to be replaced or needs to be provided in the first place. And a lot of health centers suffer for just lack of supplies. Even let's say rabies. When people are bitten by dogs, they need a series of shots afterwards. And when I was in India, I saw a patient who went to the health center and they were just out of the rabies vaccine, and he couldn't afford to leave work to travel to the next city to get it, and he ended up getting the rabies encephalitis and dying from it. Once you get it, almost 100% of people die from it. So it's almost like the medicine exists that would have saved his life, but it was just the supply chain, for whatever reason, did not provide it to that village at that time when it was needed. And the same goes for other vaccines. The same goes for simple antibiotics like amoxicillin. Pneumonia is still a very common cause of death in the developing world for children under 5. And the majority of those cases could be treated by simple amoxicillin, which costs pennies. It's almost a century old. In the US, it's hard to be far from amoxicillin no matter where you go. Even if you're in the Alaskan wilderness, you're probably not that far from a bottle of amoxicillin, honestly. So it's almost like the medical advances exist to save people, but they're not often in the right place for a variety of reasons. War disrupts the distribution of medicine, vaccines, etc. Economic barriers, corruption, just the lack of systems of upkeep and maintenance, and all these things. So I feel like a huge barrier. Yes, new advances in medicine, of course, they're wonderful, they're great, they're going to help people, and I hope they're disseminated as widely as possible. But we're still struggling to get the medical miracle advances of a century ago to all the people around the world that need it. Medicine's just not evenly distributed over the surface of the earth. Probably never will be, but that's a big barrier to getting it where it's needed and to people who need it.
And one general question: so, how does the body repair itself after some injury or illness?
So the body is absolutely brilliant at repairing itself. For instance, I like to talk about cuts, right? So lacerations. People come into the ER very often for lacerations of the skin, and lacerations of the tongue or inside the mouth or the lip are always very interesting because they almost never need stitches or sutures or any repair. Even surprisingly wide open, gaping lacerations of the tongue almost magically heal themselves within a few days. The skin itself often needs sutures, or we sometimes use glue, or we'll even use staples sometimes to close wounds in the skin. Most of those actually would be fine on their own if I just completely ignored them, didn't put any stitches. Most of them would close on their own because the cells of the skin sort of multiply and start filling in the defect and reconnect itself. There would be more scar, which would maybe be not as pretty. And so that's a big reason to still suture a lot of these, especially if they're on the face. If you can minimize a scar, why not? But almost every wound in the skin will heal itself anyway, even if we did nothing. But the mucous membrane, so the pink parts inside the mouth, the lips, the inner cheek, the gums, and the tongue really heal themselves almost magically. It's quite amazing actually how well they do. So different parts of the body are better at healing than others. The liver among internal organs is known for repairing itself very efficiently, which actually, if you look at some mythology, like the story of Prometheus, his punishment for giving fire to humans was to be chained to a rock and have a bird eat his liver every day, and it grew back again every day, so it could be eaten again the next day. So it's almost like the ancients knew that the liver had this remarkable regenerative ability to grow back, as opposed to the heart or the brain. As much as I love them, great organs, but they don't grow back so well. It takes decades or years sometimes for heart cells and nerve cells to reproduce or to fix the injury. They do, but just very slowly.
Yeah. And what role do sleep and rest play in healing and overall health?
I Probably a very big factor. I think sleep is hugely important, and it's sad because in hospitals it's very hard to sleep. While those people in hospitals are the ones who probably need sleep the most because they're ill or recovering, and there's just so much noise and disturbances in hospitals, and Uh, some of that we are responsible for, nurses and doctors. We're kind of expert at just making sure nobody gets any sleep in hospitals. There's some things we can do. There's some things though that are unavoidable, and just healthcare can be noisy, especially when someone is dying or very sick, and you need to do a lot, and there's a lot of noise and yelling and beeping. So there's a lot of room to improve that. But surely, I do think that poor sleep is probably getting worse in the modern age is contributing to certain things. Even just your appetite, right? When you don't get sleep, people eat more. It's almost equivalent to smoking marijuana. You get the munchies, and not sleeping and being sleep deprived has a similar kind of like appetite stimulant effect on people. So, how much of the obesity epidemic is due to poor sleep alone? Not all of it, but maybe a lot of it, because especially nowadays, we all have screens in our faces, up until the moment of sleep that are destroying our ability to sleep well and delaying the onset of sleep and messing with our pineal glands and our hypothalamus, which helps control sleeping and waking. So I think it's having a big impact, even in the healthy, but especially in the ill who really need their sleep all the more.
And how has the modern lifestyle impacted human health compared to previous generations?
Well, I guess there's good and there's bad, right? In modern life, we have much better hygiene, so we clean our hands well, which, as we talked about before, can prevent the spread of certain respiratory infections. Certainly improves decreases the spread of gastrointestinal infections as well, since we're all cleaning our hands. Our food supply is cleaner and safer than it has ever been in history, which is actually remarkable. How I think something people don't realize a lot, just how you can go to almost any grocery store in America and be almost certain that you're not certain 100%, but almost certain that you're not going to get some infection from the vegetables or the meat. Lately, it seems like the vegetables are there's a lot of outbreaks and recalls on fruits and vegetables, but it's actually quite remarkable how much, let's say, meat is produced by the meat industries in the U.S., and how it's distributed all around the country, thousands of miles, and very safe. It's just a real accomplishment. So in some ways, obviously, modern life is better. We have access to vaccines and medicines. I mean, pneumonia is sort of used to be a death sentence. If someone got pneumonia, and today it's like, oh, I have pneumonia. Like, I'll take antibiotics, no big deal. People don't even think about it as they used to. Let's say 100 years ago, where your family member gets pneumonia, start preparing the funeral in some cases. So our perception of certain illnesses has changed a lot as a result of that, and of course, many illnesses have disappeared due to vaccines. There's a bunch of illnesses that I can read about in books that are 100 or 200 years old that I've never seen a single case of in my career, and maybe never. So that's certainly very different. Obviously, other aspects of modern life, screens in our faces disrupting sleep, lack of physical activity, a diet where we can eat as much as we want, basically without having to exert any effort to get it. We don't have to chase down animals to eat meat anymore, and we don't have to walk many, many miles to gather all the plants we want to eat. We can do it with almost no physical exertion at all, and that's great for avoiding, starvation and deprivation. It's not great for overeating and causing obesity and other health problems. So, but I feel like if you gave any animal all the food, and lack of the need to, or the ability to survive without exerting themselves physically, like a lot of animals would need a big adjustment period. We'd all overeat and underexert and live, the slovenly lifestyle of maybe like royalty from centuries past. But hopefully, we're going to find the right balance, and that depends on individual choices, but also on the systems that are set up and incentives and things like that. So hopefully we'll find the right balance where we're not dying of malnutrition and starvation and diseases that are easily treated, but we're not, overdoing it with the food and sedentary lifestyle either. I think we will get there.
I see. And what role do environmental factors like pollution play in human health?
Certainly, pollution is a big factor. We've in the U.S. at least, our environment's gotten much cleaner in recent decades. Thankfully, just with more laws about to clean water, clean air, etc. Obviously, there's still breakdown sometimes. Even like water supplies in cities sometimes can get contaminated and be dangerous, but for the most part, they're not. But there's definitely a lot of evidence, even that pollution impacts obesity. And I actually don't know a lot about that, though I have heard that that air pollution may contribute to obesity in a variety of ways that are underappreciated. And I don't actually know, is that by increasing the appetite or changing metabolism in such a way that fat is processed or built up or depleted from the body differently. I'm not sure, but I've heard that there's a lot more to it, than we currently appreciate.
What advice do you have for people trying to navigate health misinformation online?
Well, that's very difficult. That's another thing where I feel like we have more information than we ever thought possible, and we're still figuring out how to live and how not to get drowned in that all that information, and how not to get led astray. It's almost like suddenly having so much food, more food than we need, and easier to acquire it than ever before. It's sort of like we're at risk of drowning in all this food. Same with the misinformation. It's hard because I do think doctors, their first instinct of, it's almost like in the past, people got their health information from their doctors. Doctors almost had a monopoly on information about disease and health. And, it was the public's place to just listen to their doctor and do what they say and know their place. And, the doctor knows, and the doctor speaks and you listen. That was kind of the arrangement in the past. And obviously, that is not going to fly anymore. The public, understandably and correctly, doesn't trust everything their doctor says, because doctors have been wrong many times in the past. And we doctors know better than anyone that a lot of times the recommendations we give, the diagnostics, the treatments, are not really backed up by that much evidence or that high quality evidence. And I think that doctors, we have a joke where we say, when you finish medical school, by the time you finish medical school, half of what you learned is wrong, because new research and new knowledge it's funny, but for the public, it's not funny. It's like, what do you mean half of what my doctor knows is wrong? That's actually frightening. And that's the person I'm supposed to listen to and take advice from and not question. Like, the modern person is not going to do that, and rightly so. So I think doctors need to realize the limits of their own knowledge. Doctors have to have a historical perspective where they can see that many of the dogma and the most tightly held onto theories of how disease works or how medicines work or why they work, turns out to be wrong. And there's this constant turnover of new dogma. And then eventually maybe we get past it and it's proven wrong and it's thrown into the garbage heap of medical history. So we need to have some humility. And I think I'm not sure there is a great way to counter misinformation, because there's everyone has a megaphone these days, even people who don't know what they're talking about. I do think that the health agencies need to improve their communication with the public dramatically. I think that's been a huge problem during COVID. It was a problem before COVID, since COVID. The way that health agencies and health organizations communicate with the public has to be ramped up dramatically. And it can't just be like, we are the health experts and this is the truth and you should believe it because we say it. It's not going to cut it anymore. I feel like the public needs to be shown the evidence behind what we do. If we want people to take vaccines, obviously, I think most vaccines are wonderful, wonderful scientific advancements that have improved human life. But it's not going to cut it anymore to just say vaccines are good for you. Stop asking questions. Like, the public's not going to do that anymore. I just think we need to have almost like a huge effort to communicate science to the public, and we have to be careful about what we say is known and what we say is not known, and what we say is settled science and what we say is still controversial, because there is this compunction. You want to just say, I'm the doctor, this is the truth, you should believe it. But I feel like it's not that easy anymore. So we really need to, yes, I would say you have to counter misinformation with good information, and there's a lack of good information coming out to balance all the misinformation.
I see. And my final question, so if you could give one universal piece of health advice, what would that be?
I guess, I'm a little skewed by being an ER doctor, so mostly what I deal with, right, are the calamities, not the little things. Um, I certainly think everything in moderation. Whenever someone says, "Oh, you should never eat this," or "You should always eat that," "You should never do this," "Oh, you should always do that," just a little alarm goes off in my head, and I wonder if it's true, because doctors should never be saying never or always, because it's usually wrong if you're including those words. Unless you're saying never say never, then that use of never is fine. But in general, it's very hard to make universal statements about health in every person. There's a ton of variability, and other things. But honestly, I think everything in moderation is a great way to do it. Like, I don't like telling patients, "Oh, you should never drink coffee again. You should never have one more sip of alcohol. You should never eat this or always eat that." I think you can be healthy even with small amounts of vices in your life, especially if it improves your quality of life. Then you should, if any doctor tells you to never or always do anything, you should question it.
Right. So, Dr. Reisman, I'd like to thank you for your time and for this wonderful conversation.
It was great to chat with you.